As much as we would love everything to be perfect on the first fit and beyond for our patients, sometimes the forces of the real world come into play. Don't get me wrong, with all the technological advances, it has certainly cut down the time of fits by almost half for most doctors, so we've already come a long way. In this video, I'll touch on a few common complications that can happen with a specialty contact lens fit for both scleral lenses and rigid gas permeable lenses, or RGPs. Watch on to learn more. Hey YouTube, my name is Dr. Natalie Chai. This channel brings you the latest science-based education and treatments in dry eye disease, myopia management, and specialty contact lenses to help you understand why it should matter to you for optimal eye health, function, comfort, and even beauty. Sometimes a lens will look like the perfect fit at the beginning and even after a few weeks of wear for the patient. However, the longer a lens is on the eye, the true lens-to-eye relationship begins to surface with challenges. This is the precise reason why your optometrist or ophthalmologist schedules you in for multiple follow-up visits to track the progress of your vision and also the fit. It is very important to also uphold your commitment of the bargain to those follow-up appointments, even though everything may seem totally fine and normal. In fact, that is my goal for this video, is to show you that sometimes a patient may be totally asymptomatic. Some of these complications can be minor and some more serious. Regardless, these are all complications that need to be addressed despite its seriousness. I'll go into my top 3 minor, but still important complications to note for both the scleral lens and the RGP lens. Let's start with scleral lens complications. Number 1, midday fogging. This is possibly the most common scleral lens complication. Statistically, about 20 to 33% of all scleral lens wearers experience midday fogging. Now, the main symptom for patients is blurry, hazy, or cloudy vision through their scleral lenses. Now, vision may be clear at the beginning of the day when the lenses are inserted and usually gets progressively worse throughout the day. For some patients, vision is blurry even from the get-go when the lenses are in. So what's happening? This is a condition where particulate matter and microscopic debris is accumulating in the tear reservoir between the scleral lens and the corneal tissue. Now, what does it look like to us? Now, this can be visualized with the slit lamp biomicroscope. It can look different depending on the cause of the fog, as the debris can also be very different. Sometimes it can look white and fluffy. This is known as mucin debris. Other times it can look like diluted milk-like fogging. This is associated with atopic disease and keratoconus. Or it can look semi-transparent, like olive oil floating on water with a refractive yellow color. This is attributed to meibomian debris. Now, all 3 can also happen all at the same time, just to make things super complicated. And what can we do about it? For all 3, your eye doctor will assess the fit to adjust the tear lens exchange. Depending on the type of debris, other actions such as using a thicker, preservative-free artificial tear in the lens bowl may be suggested, or an antihistamine drop may be needed in the cases of allergies, or other behavioral changes may be needed as well. It is the job of your optometrist or ophthalmologist to figure out what is causing the fogging for the patients. Number 2, conjunctival blanching of blood vessels, in other words, scleral lens impingement. Some patients may exhibit symptoms such as lens discomfort, especially near the end of the day. Others may describe a mild headache after several hours of wear. There could be noticeable redness of the eye as well. Now, what's happening with lens impingement? This is simply where there's a misalignment of the scleral lens landing. The reason why this can happen is because the eye itself is not symmetrical. Certain areas are steeper than others, influencing the way the lens lands and centers or even decenters on the eye. In these certain areas, the scleral lens is fitting too tight, squeezing and compressing the blood flow through these blood vessels. Now, what does it look like to us? It almost looks like when you press your finger down on any part of your skin and it turns a white color. This is what is termed blanching. Blanching may not be evident at the beginning of a fit, but as a patient continues to wear their scleral lens and the time is allowed for settling of the lens on eye, it can slowly turn up. Under the microscope, we would see an interruption of the natural course of the blood vessels at the boundary of the scleral lens edge, and then reappear closer to the center of the lens. Now, this blanching can be sectoral, occurring in specific areas, or there can be even something called a compression ring, where the whiteness and blanching occurs 360 degrees around. Now, what can we do about it? Your eye doctor will look at improving the edge design of a scleral lens first and foremost. We can achieve this in a few different ways, including flattening the peripheral or outside curves, increasing the diameter of the lens to spread out the weight of the landing, or making the depth of the lens a bit shallower. Number 3, conjunctival prolapse. Some of the symptoms may include patients noticing excess tissue around the edge of their iris, which is the colored part of the eye when they look at themselves in the mirror. Over time, this could lead to symptoms of dryness, tearing, and redness of the eye. Others, again, may be totally asymptomatic. Now, what's happening here? This is where there is redundant tissue from the conjunctiva, usually found along the lower half of the lens and the eye. The tissues become trapped under the scleral contact lens, and this phenomenon has multifactorial causes, including where the scleral lens is resting in its position, the height differences of the corneal and limbal area, and also pressure forces underneath the lens. Now, what does it look like to us? It is a very simple thing to detect when looking in the slit lamp. Now, your eye doctor will note a bunching up of tissue as it is being sucked under a possible loose lens. Now, what can we do about it? Now, good news is that it is usually a benign finding. However, it's a combination of the lens being fitted correctly by your doctor and also correct education on the proper insertion and removal of the lens and the appropriate wearing schedule. Now, moving on to the RGP complications. Number 1, corneal staining, aka 3 and 9 o'clock staining. This can be seen in up to 50% of RGP lens wearers. The symptoms associated with this complication can include patients experiencing redness, dryness of the eyes, discomfort, and sometimes maybe even pain with the RGP contact lens wear. So what's happening? There are numerous reasons, including excessive friction of the contact lens at the limbal area, excessive edge lifting causing the corneal tissue to dry out, a thick contact lens edge, poor blinking on the part of the patient behavior, or poor wettability of the RGP material. Wettability, in other words, is how easy is a liquid able to spread over the surface of a contact lens. Now, what does it look like to us underneath the microscope? Now, we would see areas of coalesced punctate staining concentrated at the 3 and 9 o'clock positions. Now, if left untreated for some time, this can lead to thinning of the corneal tissue, resulting in ulcers, which is not a good thing, the growth of new but leaky and weak blood vessels, and tissue scarring. Now, what can we do about it? Again, the idea is to adjust the parameters of the RGP lens for better centration and favorable movement on eye. The other thing to think about is selecting a lens material for better wetting. Considering lubrication with artificial tears may be warranted in some cases. Number 2, corneal abrasions. Now, corneal abrasions can be caused by virtually anything. For example, a fingernail to the eye from your cat or child, or dust getting in your eye from an especially windy day. In the context of RGP wear, the mechanical irritation can be from a foreign body or debris that becomes trapped underneath. As you can imagine, the symptoms include discomfort, pain at times, excessive reflexive tearing, redness of the eyes. And what's happening here? Simply put, the foreign body, whatever it may be, is essentially scratching on the corneal tissue with every blink. And with time, it can cause tissue to be eroded away. If your eye doctor hasn't already done so already in the past, they will use a yellow dye called sodium fluorescein to stain your cornea after removal of your GP lens to assess the location and the extent of the abrasion. And what does it look like to us? Now, if the defect is significant enough, it may be noticeable even without the yellow dye. However, the yellow yellow dye acts to fill in those scratches and defects to highlight that area. Now, what can we do about it? Number one is to remove the cause entirely, which is simply by removing the RGP lens from the eye and keeping it out of the eye until you're seen by your optometrist or ophthalmologist. A short term of topical antibiotic treatment may be needed for the corneal tissues to heal. A further assessment after may be needed to see if the lens design or sometimes the quality of the lens may need to be adjusted as well. Number three, corneal warpage. Often, patients are asymptomatic and unaware of this complication and continue to wear their lenses uninhibited. Sometimes minor changes in vision may be evident. There may be an increase in halos and minor distortion to their vision, which may be more evident with their glasses. This is termed spectacle blur. So what's happening? This is defined by a distortion of the corneal shape secondary to contact lens wear. Side note, it can also happen in soft lens wear too. Now, corneal warpage is especially true when the RGP lens is poorly fit, causing decrease in oxygen permeability to the corneal tissue. We usually see corneal warpage in a patient who has been a long time RGP wearer. Now, what does it look like to us? This is where we would actually need the assistance of one of the fancy instruments that we use when we fit people with specialty contacts. This is the corneal topographer. So we can use a corneal topographer to capture the shape of the cornea before and certainly after RGP wear. Then we would then compare the topographical map from each other. Corneal warpage can be defined as a cornea having central irregular astigmatism where there is superior flattening and a dramatic steepening inferior. Now, this can sometimes be mistaken for keratoconus. For us to differentiate between the two, history is super important. The other part is actually to ask the patient to discontinue their lens wear for a few days or sometimes even weeks on end, and to have multiple measurements on the topographer to evaluate changes. This is necessary to see if there are any changes once the patient has stopped wearing their RGPs. Now, what can be done? Again, you can probably guess that the first thing we consider is the fit of the lens on eye with the design. So there you have it. This is not at all a comprehensive list, but is certainly common things I see often in my clinic. Although most of these complications are generally minor, these are findings our eye doctors should be looking for and addressing even if the patient is asymptomatic. This ensures the best visual outcome and experience for the patient. Most importantly, it also protects the health of the eye in the long run. Our bodies are amazing masters instruments of adaptation. So even though you may feel and see okay, it may be a total different story when we look underneath the microscope. It is our responsibility to you, at least, just to make you aware of it and then offer some of the solutions. The key is to keep up with the follow-up schedules given to you, whether you're a new specialty contact lens wearer or a seasoned veteran with 30 years underneath your belt. That's it for me. If you found this video valuable, make sure to leave a thumbs up below. Don't forget to subscribe to my channel and click the notification bell to make sure you don't miss my new YouTube video every second Thursday. So there's definitely no shortage of content to chat about and to learn from. Take care of your eyes, and we'll see you next time.